Hello, my name is Brian Lewis and I'm an instructor at ET&S. Today our presentation is on safe lifting and good back health. Before we get started though, I'm going to ask you to pause the video and discuss any kind of near misses, or hopefully you've not had any accidents, but if you have, to discuss those as well. Discuss near misses and any accidents. Make sure you understand what happened, conduct a review. Make sure those situations don't happen again to keep people safe. So go ahead and pause the video now, and when you're ready, go ahead and press play and we'll continue with the presentation. Hopefully you had a productive discussion, and now we're going to continue with the presentation on safe lifting and good back health. So as we move forward, what I'm going to tell you is we're going to discuss, or what we're going to cover, are some of the basics, the good habits that we need to form, and the bad habits we do not need to form, the bad habits that cause problems. So, as we go forward, we want to maintain good back health, not just for work, but for a lifetime. This is a quality of life issue, as well as it can cause injuries at work. We want to avoid those things. We want a good quality of life. We want to work safely. All this is important. All this is important. So some of the basics we're going to talk about, and I will tell you right now that the basics are not the funnest thing to talk about, because when we're talking about the basics, what we're really talking about is staying in good shape. Staying in good shape for life. Now, I do not mean that you have to start lifting weights. I do not mean that you have to start training for a 5K run. I do not mean that you have to train for an Ironman or Iron Woman competition. What we're really talking about here is just maintaining a decent, good, healthy lifestyle. Being active, not sedentary. Getting up and moving around, doing things that you enjoy. Now, I know most utility workers get plenty of exercise at work because it's a very physical job. But we need to keep moving. We need to stay in good shape. We need to stretch. If you're going to maintain good back health, you need to be limber. Now, all of us have different levels of strength, and we've got different levels of limberness, right? So if you need to increase your strength or your stamina, or you need to stretch and be a little bit more limber, go ahead, work on those issues. Not only is it good to maintain good back health, it'll serve you well over your lifetime. So I'm going to ask you also to be reasonable. All right, so be reasonable in your approach. We all start out at different places. We all have different strengths and different weaknesses. If you need to consult a physician, consult a physician. If you know what you're doing, feel good about what you're doing, that's a different situation too. But the basics are staying in good shape, keep moving, make sure you're limber, make sure you do stretches. All this goes to help your muscles, your ligaments, your tendons, all that stuff, keep them in good shape, and by doing that you will also help not put too much stress on your neck, your upper back, and your lower back. You want to keep those discs healthy as possible. So some good habits that we want to do, some good habits that we want to form, some important things that we need to work on is we want to maintain a stable base. How do we maintain a stable base? We make sure our feet are wide enough. Make sure our feet are wide enough, shoulder width or a little bit more. We want to bend our knees deeply before we lift. A lot of times we get into bad situations where muscles, tendons, ligaments get hurt, discs get hurt, we damage or slip disc because we simply don't have a wide enough base, and we simply do not use our legs when we lift. So, when you're lifting an object, it's about lifting it safely, maintaining control of it, getting it to the spot it needs to go. So, widen your feet, make sure you have a stable base to lift from. Use your legs, not your back, to lift. I'm sure that most of us have heard that phrase so many times, but it is important to use your legs and not your back. Some other things we can do is engage our core muscles as we lift. This is important. Engage your core muscles. When you engage your core muscles, you take some of the pressure off your neck, your upper back, and your lower back. By engaging those core muscles, you're spreading around the stress in your core and taking some of it off your back. So engage your core muscles by keeping a strong, healthy core. There again, that's part of the basics, but it's also important to engage those core muscles as you lift. Press down into your legs as you lift. Use your thighs. Use your hamstrings, use your calf muscles. So, make sure your base is wide enough. Make sure you do not use your lower or upper back muscles to make the lift. Use your legs. Engage your core and press down with your thighs, your hamstrings, and your calves as you bring that object up close to your body. Keep the load or the object close to your body as you can. Do not put yourself in a situation where you cannot control the load because you're holding it away from your body. If you've got an object and you're holding it at arm's length, it is going to be more difficult to control. It's going to be more difficult to lift and control. It's going to be putting more pressure, more stress on your neck, upper back, your lower back, your disc that are in your spine, the space that's in between those discs. It's also going to put pressure, it's just much more stressful and can cause micro injuries, whether you realize it or you're not, until one day you finally have that needle that lands on the pile of straw and causes you problems. So we don't want to do that. Do not ask for help. Do not overestimate your abilities. Ask for help if the object is heavy, if it is awkward, or if it is overhead. Most of us do not like asking for help. But what I'm going to tell you is go ahead and ask for help. It will serve you well, especially if the object is borderline heavy, especially if it is awkward, especially if it is overhead, or a combination of two of those three. It's more important to do it safely than it is to prove or show how prideful you are in your ability to do a task. A lot of times, something isn't heavy, it is awkward. So, if you have an object that's fairly light, but it's going to cause your back to be in an unnatural position, ask for help. You not only want to lift the object, you also want to maintain control. So if it's heavy, if it's awkward, if it's heavy and awkward, be careful. When we talk about objects that are overhead, anytime your elbows or your hands go above the level that your shoulders are, you are already starting out in a poor ergonomic position and can cause all kinds of stress to your shoulders, ligaments, tendons, rotator cuffs, also your neck and upper back. So you can actually strain those muscles quite easily if you lose control of a heavy object that's overhead, an awkward object that is overhead. Do not be too prideful to ask for help when you have to put your body, or you're planning, is what I should say, planning to put your body in an awkward position. Make sure you ask for help. There's nothing wrong with it. Do have a plan. I personally think this may be one of the best ideas. Having a plan. One of the best steps is to think about what you're trying to accomplish and how you're going to accomplish it. By having a plan, you're going to make sure that your path is clear. You're going to make sure that you have addressed any potential slips, trips, or falls. Address any kind of stairs that you may have to go up or go down, any kind of inclines, any kind of declines, any potential problems along the way where you might run into other people who do not know what you're doing that cause problems. This is really important to have a plan. Make sure the path is clear. Make sure that whoever is helping you, if you're doing a team lift, make sure that's communicated. Make sure you have good communication. Make sure everybody understands what's going on and how you're going to do what you're trying to accomplish. It's really important. Now, some things that most of us do not like to hear, and that is the don'ts. I can't speak for everyone, but I personally do not like hearing what I should not or cannot do or don't need to do. And I'm sure a lot of you all are the same way. The don'ts are not nearly as good as the do's, right? It's important to know what to do, and it's equally important to know what not to do. So now we're going to cover the don'ts. Do not try to lift something that is too heavy for yourself. And I've already mentioned this before, but a lot of us will overestimate our strength or our ability to lift a heavy object. And it goes right along with not using quick, explosive movements. If you played sports when you were younger or play sports now, you're somewhat encouraged to use quick, explosive movements. Quick, explosive movements in football, baseball, basketball, softball, soccer, a lot of times can be the winning edge. But as we grow older and we're not playing those sports, quick, explosive movements tend to cause problems with our muscles and our skeleton. We do not want to injure our muscles, our ligaments, our tendons. We sure don't want to injure our neck, our upper back, or our lower back by using quick, explosive movements. When you make your plan, if in your mind your plan is using a quick, explosive movement to get something done, you have not planned correctly, and it's a sure sign that the object that you're trying to lift is too heavy for you. So do not try to lift something that's too heavy for you, and do not use quick, explosive movements. When you lift an object, you want to be smooth and consistent and maintain control. You want to keep it as close as you can to your chest. And if you're doing a team lift or not doing a team lift, you need to have a plan. Those things are important. If you have a plan and you're doing a team lift, it's important that you and your partner or partners communicate on how the lift is going to go. Everybody understands what's going to happen. Do not twist or turn, and do not forget to keep your back in a neutral position. This is really important. When you twist or turn, you're putting your back at risk, especially your lower back. You want to maintain a neutral position. You want to maintain control of the object. You want to maintain your ability to do what you need to do and do it in a proficient manner. So if you need to go right, to maintain that strong base, lead first with your right foot to turn right. If you need to turn left, lead first with your left foot to maintain that strong, wide base so that you do not hurt yourself, and if you're doing a team lift, that you do not put somebody else in a bad situation. So you want to keep your back in a neutral position, keep good posture, and do not twist and turn. You want to do all those things to maintain control. That's important. So, as we talk about a summary of what we've talked about here today, the basics. Take care of yourself. Do what you can to maintain good health. Remember, that doesn't mean lifting weights. That doesn't mean training for a 5K run. It doesn't mean training for an Ironman or an Ironwoman competition. It simply means being active. Being active, making sure that you're flexible, stretching if you need to. Just the basics of a good healthy lifestyle. Do use quick lifting techniques. Make sure that your feet are wide enough that you maintain a wide base. Make sure that you do not twist and turn. Lead first with your right foot if you're going to turn right. Lead first with your left foot if you're going to turn left. Make sure you engage your core muscles and press down through your legs as you make the lift. Engage your thighs, hamstrings, and calves as you lift an object. Keep the object as close to you as possible. The further away from your body an object is, the heavier and the harder it is to control. We want to avoid those situations. Do not get into the bad habits that will eventually cause back trouble. You do not have to injure your back in one lift. A lot of times it's injured over time. So do not fall into those bad habits where your back is not in a neutral position, when you do not have your feet or your base wide enough, where you do not maintain control. It's these do nots that eventually cause muscle, tendon, ligament tears, can cause slippage of disc, can cause problems with your spine, either in the lower back, the upper back, or your neck. Do not start out in a bad ergonomic position without help. It's important. I know the do nots or the don'ts, like most people, it irritates them to hear what they cannot or should not or not to do. The do's are a little bit more acceptable. But remember, we're not just talking about being injured at work. We're talking about a lifetime and enjoying your life. So it's important to maintain good back health. So please follow the basics. Use correct lifting techniques. Do not fall into bad habits. Thank you once again for your time. Thank you for paying attention. Please make sure that you fill out an attendance form and send it to the JTNS office. If you have any questions about this presentation or other safety and health related issues, please contact your JTNS representative, your instructor. They will be more than happy to answer any question that you have. If you come up with a question that we do not have an immediate answer for, we'll do some research and get back to you. So, having said that, have a wonderful day, and we'll see you in the future. Thank you. Bye.